Can you ever imagine death after eating chicken shawarma? It's shocking, but unfortunately, it is true. Recently, a girl died after eating chicken shawarma in Kerala. Shigella infection surfaced after bacteria was confirmed in the blood and the feces of people undergoing the treatment after they reportedly consumed chicken shawarma. Now, and this is the story for the day. Hello and welcome to Eduaura's Insight. I'm Priya Kumari bringing you about the story of the Shigella infection. We all are aware that food poisoning is fairly common and can occur in a range of situations. Now, the question raised that how common is Shigella infection? What are its symptoms and what precautions you should take? Recently, the Kerala Health Department identified Shigella bacteria as the cause for the food poisoning incident in Kasaragod, which claimed the life of a 16-year-old girl and led to 30-odd others being admitted to the hospital. The presence of the bacteria was confirmed in the blood and the feces of the people undergoing treatment after they consumed chicken shawarma from an eatery at Chivathur in Kasaragod last week. Police have arrested the owner and the staff of the eatery. Now, what is Shigella? Shigella is a bacterium that belongs to the Enterobacter family, which is a group of bacteria that reside in the intestine, not all of which cause disease in humans. It causes an infection which is called as shigellosis. It mainly affects the intestine. There are 4 types of Shigella bacteria that affects humans, that is Shigella sonnei, Shigella flexneri, Shigella bodiei, and Shigella dysenteriae. Also, you must know that the 4th type of bacteria causes the most severe disease because of the toxin which it produces. The infection spreads easily as it takes only a small number of bacteria to make someone ill. The disease is spread by directly or indirect contact with the excrement of the patient. It is a food and waterborne infection and can happen when someone consumes contaminated food. Now, you must be aware that what are the symptoms of Shigella infection. Most of the patients with Shigella infection experience diarrhea. Sometimes the diarrhea can be bloody in nature as well. Stomach pain, abdomen ache, and fever. These are few symptoms. As per the Centers of Disease Control and the Prevention, that is the CDC, the symptoms usually start 1 or 2 days after infection and it lasts for 7 days. In some cases, bowel habits, frequency, and the consistency of stool do not return to normal for several months as well. Now the question raised that how widespread is Shigella infection? Shigellosis happens, but it is not a very common infection. Shigella outbreaks appear to be exhibited during pregnancy and also in the children under 5 years of age and in those with weakened immunity system. So this is the story for the day. But before winding up, let me tell you that what are the precautions one must take to avoid the Shigella infection. Akin to the prevention of other usual poisonings, the measures to prevent Shigella infection are similar to any other food or waterborne infection. Doctors advise that one must wash their hands thoroughly and before any meal, and one must ensure that the source of drinking water is clean, while fruits and vegetables are clean, fresh too. So, for more updates, stay tuned with us. Thank you so much.